My name is Maddi Niebanck, and I'm a young hemorrhagic stroke survivor. When I was 22 years old, 1 week after I graduated from college at Georgetown University, I went in for scheduled brain surgery to remove an arteriovenous malformation in the right occipital lobe of my brain. An arteriovenous malformation is an abnormal tangle of blood vessels in the brain that lack capillaries. So there is not the correct blood flow to the brain, and it's very dangerous. The reason that I knew that I had this AVM is because when I was 7 years old, I started getting severe debilitating migraines, which culminated in a series of migraines that lasted 24 days straight without relenting, in which I went to the ER. None of the doctors knew what was going on. My neurologist informed my family that this is not normal. So he ordered me an MRI scan, and that brain scan revealed that I had this AVM in my brain. Once we found out that I had an AVM, the question then became, what are we going to do about it? I consulted with many different doctors and neurosurgeons, the majority of which told me that my AVM was so large it was technically considered inoperable, and they did not feel comfortable doing the procedure. A smaller minority of the doctors told me that my AVM was so large, it needed to be removed immediately. With each year of life, there's an increased chance of the AVM rupturing, with a 50% chance that it would rupture at some point in my lifetime, and if it did, a 10% chance of death. I just decided I did not like these odds, and so ultimately I decided to move forward with a brain surgery. 10 days after I graduated from college, I went into New York Presbyterian for my scheduled brain surgery. Since my AVM was so large, I had to have a series of preoperative procedures beforehand. The pre-ops actually ended up causing a blood clot in my brain, which burst. So I ended up having a massive stroke in the hospital and am rushed into an emergency surgery. The neurosurgeon literally told my parents, the situation is grim. I don't know if she's going to make it. I'll do everything I can, but it doesn't look good. So thankfully, I did manage to make it out of the operation alive. My surgeon was able to stop the bleeding and remove the AVM. When I woke up from a medically induced coma, I discovered I was completely paralyzed on the left side of my body. Everything from the left side of my face, I couldn't talk. My left and dominant arm and leg, I couldn't speak, I couldn't swallow, I couldn't do anything. And I lost half of my peripheral vision on the left side of both of my eyes. I was essentially starting from square one and had to go through tons of rehab, cognitive, speech, physical, occupational, in order to regain the skills that I had once taken for granted. I'm very lucky in that I have made a pretty incredible recovery to the point where now I am working full time. I travel all over the world on my own. I live independently, and I can walk without an assistive device. I will wear a brace because I do have foot drop when I'm out in public. The biggest problem that I deal with to this day is actually spasticity. I have a lot of spasticity and tone in actually all over the left side of my body as a result of the stroke. So I actually go in every 3 months to get Botox, and my doctor will give me 800 units of Botox injections everywhere from the left side of my neck to my upper back, my arm and wrist, and my leg as well. I struggle a lot with spasticity, and it's really rather uncomfortable to live with, and so I've always been searching for new solutions or things that could maybe help alleviate the discomfort. I've been using the pulse device. I do it on my wrist extensors and wrist flexors, as you can see here, because that's an area on my arm where I notice that I have a lot of tone. I've just started and I'm enjoying it so far, and I'm excited to continue to see results with reduced spasticity over time with use of the pulse device.